Are X-rays harmful to the human body in any way?
In excess they can be, but the exposures that we do, especially with the newer machines that we have, are absolutely minimal. So like to take one of the films that we have, you get more radiation from eating a banana.
So what do you do to protect yourself and your patients from harmful effects?
Our button that actually exposes the radiation is over 6 feet away from our machine or from the source of radiation, and that's actually the safe distance, if you will. So I actually don't expose people. My assistants do, but they stay 6 feet or beyond past that. As far as patients go, we actually have patients wear a lead-lined apron, and historically that has been really critical. But once again, nowadays with the minimal dosage that we have, even the experts will say you really don't need the apron for what we do. Higher doses or hospital-grade type doses maybe. The other thing we do would be, as far as like pregnant women, we don't take radiographs on pregnant women just as an absolute precaution.
What are some guidelines that you guys go by for radiation?
Well, we have our machine inspected twice every 2 years.
Do you use film or digital radiography?
Right now we use digital radiography. We actually just bought a new machine about 6 months ago. Prior to that we used film and used actually a processor. The benefit in digital radiography is, number one, it's a much more clear image. It happens much more quickly. There's a lower radiation dose per patient, and you don't have the chemicals that go in a processor, because it's basically either on a computer screen, the image, or you can print the image on a regular printer. It's one of the first diagnostic tools that we use. One of the things that we do would be to assess wisdom teeth, for instance, and see if they need to come out or if they can stay. If there's a tooth that we can't see clinically, maybe it's up in someone's bone and we need to find it. So number one, we would know it's there. Number two, we would know its location or position, so that once we open some, cut through the tissue, went through the bone and found the tooth, we could actually put a brace so that we could bring it down into place, so that they would have that tooth to serve them.
So how has technology changed in using X-rays since you started dentistry?
Probably the biggest thing is digital imaging, because we can, just like in a digital camera, you can take the image and zoom in on it, or change the color of it, or give a negative image of it. And what all that does is it basically helps you get a different view or a more clear view of what you're trying to see. So the digital part has really come a long ways. From old times, just the less dosage of radiation is great for your staff and for your patients.
So what would you do if you did not have X-rays?
You can treat patients without X-rays, but typically the standard of care is, if you treat patients, you would use X-rays to assess the roots of the teeth, the bone of the teeth, and then the teeth themselves. Now, sometimes in a little bitty, like a 7 or an 8-year-old, I actually I call it Mr. Finger X-ray, but I can literally take my finger up by their bones and feel the teeth or feel the developing tooth buds, to see if the tooth is there and to get a feel for what position that tooth is. I've been doing this for a long time, and so I've kind of...
Besides X-rays, how is science helpful in your job?
We basically use science on a day-to-day basis. Number one, anatomy and physiology, the anatomy of bones and teeth, the physiology of how a tooth moves or why it moves. We use physics because we actually put forces on teeth with certain vectors to move the teeth in directions or angles that we want them to use. We use chemistry because the glues and the adhesive that we use to, for instance, if we clean a tooth before we put a brace on, what we use is 40% phosphoric acid. That's why it has a bitter taste. You know that. It has a bitter taste, but now you know why it has a bitter taste. That's not harmful because we suction it all out and we copiously rinse it with water. But that in itself is 4 or 5 different facets of science where we use on a daily basis.
All right. Well, thank you for answering my questions.
Well, you are so welcome.